our first speaker. It's just really a great pleasure to introduce Dr. Jose Cordero, who's the department head and the Gordon L. Virginia Patel Distinguished Professor of Public Health at the University of Georgia. He has a very distinguished background with high-ranking positions in Puerto Rico, where he was the dean of the School of Public Health, and with CDC. He's got a tremendous background, has made tremendous contributions across the board in epidemiology and public health, and has been very focused on what his topic will be today, and that's Caribbean hurricanes.
Thank you very much, Dr. James, for your introduction, and it is a pleasure to be here. My topic today is going to be on Caribbean hurricanes, but really will be to talk about the rest of the story. First, I thank the previous speakers because they have given the big picture of climate change and preparedness and climate and health. And what I will be doing in these 15 minutes is just sort of focusing on the challenge that hurricanes Irma and Maria have been for Puerto Rico. And on that, I would like to bring three key points. These hurricanes affected not only Puerto Rico, but most of the Caribbean. And in Puerto Rico, it certainly affected nearly the entire population. And as already have been said by previous speakers, vulnerable communities, those with chronic diseases, the elderly, and those with disabilities, have the greatest adverse impact from these events. And that building resiliency among vulnerable populations must be a major priority in this disaster preparedness. To that, I would add that these events never happen at the right time, never happened when everyone's well prepared. And the fact that we have Hurricane Irma just a few weeks before Hurricane Maria is an example. But also, looking at the context of the situation in which of the affected areas, it's also very important in planning and post-disaster response. So just briefly I think that many of you already know or have been in Puerto Rico. Puerto Rico is the smallest island of the greater West Indies or Antilles. And our population based on the 2020 census is 3.2 million, which actually is a lower figure than what the population was in 2010. Part of that decline is because the number of births actually have been declining from about 60,000 births in 1990 to about 22,500 in 2020. And it's decreasing about 1,000 or 2,000 fewer births a year. In terms of health coverage, Puerto Rico has, I would say, greater coverage that has been noted or what is currently in the U.S. But even with this greater health coverage, the percent of the population in fair or poor health is much greater than the U.S. I would add to that Puerto Rico is the one jurisdiction in the U.S. That actually is endemic for dengue, chikungunya, and also Zika. And in September 20, we had Hurricane Maria hitting Puerto Rico, and it caused a collapse of the electric grid. Basically, 98% of the power generating was lost during actually almost the first few months. About nearly half of the water supply or system actually was affected, and over 98% of the Wi-Fi towers throughout the islands were destroyed. And we say that they were expecting to have something like 50 or 60%. So the projection was certainly a little bit on the low side from what actually happened. Um, Also previous speaker talked about the excessive death. There are different estimates, but clearly over, especially you're looking at both deaths that occur in Puerto Rico, but also the migrants that actually left Puerto Rico to seek healthcare in the U.S. The estimate is a little bit higher, about 4,000, and certainly that included mostly people with significant chronic conditions. Here's just a picture of Hurricane Maria. You can see the blue tarps that are in many of these homes, and you see a bridge that was actually lost in this area, in actually almost the center of the island. The point to bring this is that these are pictures not of right the few days after. This is actually 6 months before the event, and just to point out that recovery in Puerto Rico has been tremendously slow, and that even 4 years after the event, still there are many areas that still need to recover, especially in buildings and houses. I'm sorry about the passing. So the one of the good things that happened following the hurricane is that we were approached by the Medtronic Foundation and requested that we would do a rapid needs assessment. And the question was, what are the most pressing needs post-hurricane? And the foundation was targeting the 6 municipalities that are where the Medtronic company have facilities in Puerto Rico. Actually, Medtronic, the company, is the second biggest employer in the private sector in Puerto Rico. Obviously, the government in Puerto Rico is the #1 employer. So we actually did a series of focus groups and also met with key informants to address these questions. In total, we saw about 130 participants with 6 municipalities. And the way that we approached this needs assessment was following the social determinants of health and following what is Robert Wood Johnson Foundation calls the culture of health. And it's based on the concept that already also have been mentioned by speakers, is the connection between social determinants and health, whether it's transportation, housing, employment, public safety, education, and so on. And here is a very brief summary of what we learned from that focus groups from that analysis. What we have in red are what the top pressing needs after the hurricanes, and the ones in green are the top pressing needs after the hurricanes. What actually becomes quite obvious is that there are certain factors like food security, communication, public safety, or even discrimination that were basically less than 5% reported that as a pressing need before. And you can see the impact it had post-hurricane. And so it is just an indication of how the impact that the hurricanes had, and especially the way that the post-event recovery actually happened. I'd like to point out to transportation that although was a little over 30% of the respondents indicated it's a pressing need before, but how much it actually increased, actually nearly doubled. But we did go a little bit deeper on why transportation was an issue. And this gave us an example of how connected transportation and the other factors are. And one example from one of the women that we interviewed was Yes, transportation was a big priority because I could move my car from because of the roads are impassable, but I need to get somehow to the pharmacy because I lost the medications in the flood that ensued. That my house was flooded, and and by the way, I did manage to get there, but couldn't pay for the medicines because credit cards were not available. It all became a cash basis. So fortunately, the pharmacist did give her medicines, and but it just reflects the linkage between transportation and between these different kind of needs. It also points out the large need for preparedness, whether it's in food security. How do we have a more resilient system of communication in terms of Wi-Fi, um, and address other needs? Uh, we were fortunate that if the Medtronic Foundation said, let's just provide some uh, recommendations, and we'll consider funding some of these. And oh, let me just go on and just describe among these access to care and the before and after, and then I'll go into the foundation. Um, but the before the access, the challenge was dealing with referrals to specialists and also transportation to healthcare facilities. But after that, the refills of medications was one, mental health services, the transportation to facilities that I just mentioned. But there were a number of pharmacies that actually closed that limited access to medicines. And clearly there was a major problem for those that are medically fragile, particularly those that have like needed, for example, a renal dialysis or had CPAP or have some uh, um, support systems that required electricity. So we recommended developing a group, a program for developing community health promoters. And the reason is that we have had experience with community health promoters as being an important linkage that could actually link health services to social determinants and the community. And so we proposed a developing or deploying community health promoters to link these services, especially chronic diseases, mental health, and also finding the people with disabilities. We were able to deploy 21 community health workers, and we went through the whole process of training and connecting them to the federal qualified health centers. Actually, they all are employees of the federally qualified health centers, and that's important for the sustainability when this funding for this program ends. The main focus has been on addressing barriers between terms of the social determinants and can control diabetes. For example, someone cannot get to the clinic to be checked for diabetes because of transportation. Is how do we make those connections? And that sometimes requires connecting to services offered by the municipality. The other aspect is how to build resilience for disasters, but also looking at the need for individual preparedness and the development of evacuation plans. The other aspect that we learned was the need for shelters that actually could attend to people with chronic diseases and that would have place for keeping up with refrigerators or freezers for like medications like insulin and so on. And actually we have worked on developing those types of models of shelters together with the municipalities and the Puerto Rico authorities in preparedness. So far, we have actually the recruitment is actually happening in the 6 municipalities, and they're shown. 2 are in the northern part of Puerto Rico, one near San Juan in Cataño, and the other in Loíza. and another town maybe about 40 miles east of San Juan. The other two are in Ponce, which is the second largest city in Puerto Rico, and Villalba, which is a mountain municipality, and that's the southern region. And then the third area is Humacao and also Juncos, and that those red and green dots actually, that's about the area where Hurricane Maria came through and then exited in the northwest northwest coast of the island. So we have recruited about 640 participants that have diabetes, hypertension, and asthma that are connected and have their a community health promoters to work with them. We expect, and the plan is to recruit at least 1,200 participants in the course of this program. And what we have done so far, we have demonstrated an improvement in control of hypertension, but also hemoglobin A1C, as well as if there are combinations. We are now at the stage as part in terms of our timeline to develop preparedness plans. And we have worked with a group of experts on plans on how should a shelter with call it additional technology should look like. And we are now at the stage of working with the municipalities on how these shelters can be planned and developed. This has been possible because of a great collaboration of many partnerships that include all the municipalities, and we have a very close collaboration with all the preparedness and response groups in each of the municipalities, as well as at the state level for Puerto Rico. There are collaborations with a number of NGOs, as well as the federally qualified health centers that are shown on their clinics. Also, beyond the funding for Medtronic Foundation, we recently received funding from CDC that would allow us to expand this program, and that's going to add another 32 more community health promoters. So we will move from covering 6 municipalities to about nearly 50 municipalities is our expectation. And so this is an example of how the community has come together, and through training, collaboration, and all these things happen at the time that when we started. Not only we have to deal with the effects of the hurricanes, but also shortly at the time when we were about to start, there were very serious earthquakes in the southern part of Puerto Rico that while the major destruction was in those areas that included Ponce, one of our municipalities, it really impacted the entire island. And following that, obviously we had COVID. So that has actually led to major adaptations, and has been a reminder that programs that are trying to build resiliency and improving health in communities need to be highly adaptable. And so, for example, our original plans were to have home visits for all the community health promoters, and we have done that in part, but also have to rely on using telehealth and telemedicine, and that actually has been an important addition to our program. This is work in progress, but what you see in these activities is the response that Puerto Rico has had to address the need for improving the health status of people with chronic diseases, but at the same time helping getting these communities better prepared for the next major hurricane, that it's not a matter of it's going to happen, but more of when. So with this, I'd like to just finish with a reflection. And this is something that I saw many times during my time I worked at CDC, and I had a chance to visit colleagues at the Hubert Humphrey building, which is the headquarters for the Health and Human Services Department. And right there in the lobby, there's this encryption in the wall from Hubert Humphrey, the very famous vice president. And it says, once was said that the moral test of government is what the government how the government treats those who are in the dawn of life, the children, those are in the twilight of life, the elderly, and those who are in the shadow of life, the sick, the needy, and the handicapped. And I would say that this reflection is not only for the government, but for the entire community. And it's a measure of how we as communities work and support one another, ensure that everyone can be healthy and safe. Thank you.
Thank you, Dr. Cordero. The one thing that's really been great about working with Jose over the years is taking things from discussion to operation to doing things.